So, a couple of years ago, marketers used to say that about half of the money spent on marketing was being wasted. The trouble was that you didn't know which half. This has changed, though, radically, hasn't it? With better technology to track outcome and costs, marketing campaigns we know how these marketing campaigns actually perform, particularly in my industry, in the internet industry. I want to tell you today that a similar type of revolution is actually going on in healthcare. Because by going and looking at treatment outcomes and costs, we can actually make smarter decisions in healthcare. And I know about this revolution because I got very engaged with it about 7 years ago at the time of my father's death, which was, of course, very sad for me and my family. And at the time, my mother got ill as well. So you can imagine my desperation to actually try to understand whether they were getting good or bad healthcare. But when I looked out and tried to find information, I couldn't find any. And to change this, I gathered a group of friends and we started collecting data on healthcare performance. And to my surprise, there was actually a lot of data around. It's just that nobody had bothered to make it accessible for people like us. And so we worked on this project for about 2 years, and after 2 years, we ended up with something like this. Sorry for the Swedish here, because we did it for my home country in Sweden. But what we did, we collected this data for hospitals and clinics around the country, and we looked at several different types of treatments. What you can see here in specific is heart attacks, which my father died in. And we could clearly show that different hospitals were not as good at treating heart attacks as others. And you can go in today to the site and do these comparisons for different regions. This specific search was done for the region where my father died. So, to our surprise, this website became very important, not just for patients, but also for doctors and politicians who started visiting this site and actually checking and contrasting and comparing the performance of hospitals to be able to make better decisions about healthcare. And although I left this project about 3 years ago, still today I'm very concerned with looking at treatment outcomes and costs and trying to understand the healthcare systems around the world in an effort to figure out better ways in approaching it. And when I moved to the US, I of course looked if my background could help in understanding the debate going on in this country. And I want to share with you some of the findings that I found. And when you begin looking at a country's healthcare system, it's always good to look at the big picture. And the big picture for healthcare data is life expectancy. And when we look at that, US does fairly okay. Unfortunately, it's far from the best. So many of the advanced economies achieve a higher life expectancy for its population than the US. But it's not just about the outcomes, of course, it's also about the costs. So what I've done here is I've plotted life expectancy, which is higher and higher the higher you go on the graph. And to the side, you can see higher and higher costs spent per person on healthcare. And I put in all the countries there, and I faded a couple of bubbles, which you can't see that clearly here as well, to show that actually there's a very strong correlation between the money you spend on healthcare and the life expectancy that a nation achieves for its population. In fact, a lot of researchers believe that this correlation is so strong that you can nearly draw a line through these bubbles and figure out, how much more years a country is buying for its citizen by investing in healthcare. Unfortunately, there is one country that they can't explain the data for, and You can probably guess which one that is. And as you can see, US is a bubble here that it's beside the other bubbles. And if I were to put that into words, this essentially means that US is spending nearly twice as much on healthcare as any other advanced economy, still achieving less. And when we dig a little bit deeper into the data, the picture is still grim, unfortunately. So US spends twice as much on healthcare, but we have on average half as many hospital beds. Our infant mortality rate is nearly twice as high. And then, of course, obesity in this country is more than twice as big of a problem here than in many other advanced economies. In fact, when I looked at the data, there was only one area where I could see US ranking #1, and it was in the number of MRI scanners per person, which is, of course, a fairly expensive, high-tech type of examination. And when we look at benefit and cost analysis, we have to think if this is the right type of investment. So the data is pretty conclusive, unfortunately. Almost every second dollar spent in this country on healthcare is being wasted, at least if we compare to other countries. And if this is true, then we have to ask ourselves, who is wasting the money? Well, we have a system where the federal government pays for about half of the healthcare of this country, and then we have private entities paying for the other half. But the impact of the waste is not equally distributed. And I'll try to explain why. I've taken my own company as example. So to your right here, you can see that in PREZI, we spend about 4.5% of our money on healthcare insurances for our employees. And if we were to be able to cut down on waste here and half that cost, that would make a change in our bottom line. However, for the federal government, who spent about 37% of its budget on healthcare last year, cutting down on waste would be a significantly more important thing to look at. In fact, you could very easily argue that we wouldn't be having a federal budget deficit if we were spending healthcare dollars efficiently. And at this point, I think it's very important for me to point out that the debate on whether healthcare should be publicly or privately financed is not necessarily the most important debate to have. Because in the chart that I'm showing you here, there's countries who have all sorts of different financed healthcares. There's countries that have public-only financing of healthcare. There are countries with private-only financing. And then there is countries like the US that has a mix of private and public funding. Now, what this chart shows us is that the really important question to answer for us as a society is how to spend our healthcare dollars efficiently. And if we do that, then we can fix a lot of economic issues. And the good news is that looking at treatment outcomes and the associated costs can really help us to make better decisions here. I'll give you an inspiring example from New Jersey, where the work of Dr. Jeffrey Brenner has shown that by mapping out costs and treatment outcomes on a map in his home county of Camden, he could identify very easily these so-called hotspots where a lot of the costs were actually being built up. So what Dr. Jeffrey Brenner did was he assembled a group of nurses that started making home visits to these areas, and upon doing that, they actually reduced costs for some of these individuals by up to 50%. And he did that not by lowering the quality of healthcare, but actually increasing life quality for these patients. So would there be an industry that we can take an example of to inspire us how this kind of information should be made available to us? I don't think we have to reach far. Take, for example, cough syrup manufacturers. So we have asked cough syrup manufacturers to not claim any benefits to their products that cannot scientifically be proven. So in this case, we can see this particular drug temporarily relieves cold symptoms. And because drugstores conveniently put these cough syrups next to each other on the same shelf, I, as a consumer, can go into the store, compare the benefits and the costs, and make a decision whether I should be getting this cough syrup. Pretty easy, right? Let's imagine just for a second what that would be like if it was the same type of information for something a little bit more complicated, like a heart surgery. So I've taken an example here, a made-up example, and I looked at PCI surgery, which is a surgery where you go into the heart and expand the arteries. And I looked at what kind of scientific benefits are associated with this. And it has been clearly shown that it can alleviate chest pain. However, the experts are still arguing today whether this procedure actually contributes to longevity. It's an important note. And then, of course, if I were to go and get this kind of surgery at a hospital, I would want to know, is my hospital good at performing this kind of surgery, right? So I included an imaginary hospital called St. Matt's and a rating for it. And last but not least, something that we're not used to getting, but I think a very important data point, is the price for the surgery. And by the way, none of the information included here is impossible to get. It just takes a little bit of work. And there are a lot of people working on this now. So for example, the state of Massachusetts looked at PCI surgery and found that for some of its major hospitals, there were huge price differences, although they couldn't show any big quality differences. And I found this information just laying around on a governmental website on the state of Massachusetts. You can find it yourself using Google. And there are many other projects like this. I want to mention one more. For example, calhospitalcompare.org, which is an initiative by California to track all treatment outcomes of the hospitals of its state. So this is a great proof of concept that we could do it nationwide, and we can actually understand what is the quality being produced at our hospitals. Unfortunately, this website today does not include information about prices yet. But really, all we'd be asking for is to have the same type of information for healthcare services as we already have for cough syrups. And if we were to have that, then I believe that we can start cutting down on waste and being smart about the investment decisions that we make on our healthcare. So, hang on a second, Joe. If this is such a great idea and it's so easy, how come that nobody is doing this before, right? Well, I can only go back to my own experience about 7 years ago when I was in the same situation, facing the death of my father and my mother being sick and not having access to information. Why is that? Well, what I learned from that experience was that the issue of making data on treatment outcomes and the related costs is an issue that is being stuck now between 3 large organizations or groups of people. Politicians, insurance companies, and hospitals, none of them really feel that this is their responsibility to make this data available, although they have large parts of it. But what I have also shown you today, and I hope that an example is through, for example, the California or the New Jersey project, is that this information can be available, and that there are individuals in all of these organizations who are working today to get us there. And really, all we need to do to accelerate this process, I think, is to start supporting these people actively, and I believe that they deserve it. Thank you.